I spent many years also living in Spain, with all the Mediterranean diet, which is really wonderful. But you have a lot of people, which have, I would say, at least once a week, wonderful sardines, which are very rich in omega-3.
Brilliant.
They taste very well, but if you fry them in sunflower oil, they swim in sunflower oil. You're neutralizing a lot of your benefits, which come from the omega-3 from the sardine again.
That's exactly what the studies show, Peter, as I'm sure you know, but many people don't. It is only when fish and seafood are deep fried or even shallow fried in buckets of omega-6 rich vegetable oil that you don't see the benefits in the population studies for the heart, for the immune system, for the brain of fish and seafood. So you're quite right. Oh dear. And again, people need to know these fatty acids are highly perishable. This is why the quality of supplements matters. This is why too much light, heat, or air will very quickly destroy these highly reactive, fatty acids. Omega-3 are even more perishable than long-chain omega-6, but the polyunsaturates, that's right, they can very easily be degraded. What we therefore need to do is to teach people that you don't need to overcook fish. Of course you don't. Yes. In fact, it's far better if it's very lightly poached, steamed. And of course, the Japanese with their sushi I'm not a great fan of raw fish, I will say that. Or it needs to be very well marinated. And high temperatures will destroy. Yes. Mixing with omega-6 rich vegetable oils is close to criminal in my mind.
Exactly. Well, you see, this is exactly one of the reasons why we're doing these interviews, in order to chat about these things and cover the message, Now, allow me to go back once more to ADHD.
Of course.
Because I think this is really important, because I've met a lot of parents which have children. Now, first of all, first thing I'd like to say, and I'm not sure what you think about this, but I think the diagnosis ADHD is given very fast at the moment. It's very quickly to children. and a strong medication, like, I don't know if the pronunciation is correct, Ritalin or Ritalin.
Ritalin, yeah.
I think in many cases it is not necessary. And we saw also with some of the parents which are taking our products in Spain, that they also see positive effects with just simple omega-3 supplementation. And I'm always saying, even if you don't even need to avoid Ritalin, but maybe if you can reduce the dose by an omega-3 supplementation, that's already a huge step forward. Do you think that is correct? Have you also made this observation?
Okay, I largely agree with almost everything you're saying here. Let's start with the diagnosis, because this is it. Across the whole of psychiatry, psychology, these diagnoses, they're descriptions. They can be very good and very refined descriptions, but they are only that. And the AD and HD diagnosis, you're quite right. This has changed over the years. It was particularly broadened out in the early 1980s with the change in diagnostic system of, that was brought in then, and almost the creation of attention deficit hyperactivity disorder. There always had been, things that captured severe hyperactivity, restlessness, and so on. But the bringing of attention into this broadened it out then. Let me say that, of course, the cardinal diagnostic features: attentional problems, inattention, hyperactivity, and impulsivity. And the way psychiatrists are taught as well to look at this diagnosis is as two dimensions: inattention, which can exist in isolation and can give you the diagnosis alone; hyperactivity, impulsivity, or both. So you get the combined type AD. Now, firstly, what all the neuroscience says, there are actually three dimensions here. Hyperactivity is not identical to impulsivity. They may correlate tightly, but they are different things. And again, rather than just focusing on the symptoms, a good medical system and a good clinician will always be looking for underlying causes and trying to see if we might be able to treat those, rather than, as the drugs used, the stimulant medications like Ritalin and most medications used across psychiatry, actually, they can help reduce symptoms, but all the evidence shows they do nothing at all to tackle underlying causes. Okay. Another thing about the ADHD diagnosis is just how massively it overlaps with other diagnoses, both physical and mental, but let's focus on psychiatry. Now, again, for the last 20 years ago, big population studies in Scandinavia absolutely showed if a child met full criteria for ADHD, 2/3 of those children had another different full psychiatric diagnosis. No, sorry, it was 4/5 had one other diagnosis. 2/3 of them had at least 2 other diagnoses. Okay. I was getting it. So if you are told that your child meets criteria for an ADHD diagnosis, quite frankly, that's not telling you very much at all until you know more about, okay, what are the other issues that, to my mind, really do mean that treating ADHD as a single entity is just wrong. Okay. It works very well if your main motive is to, give out a lot of medications that will kind of, suppress the symptoms, but it is not helpful at all for those parents or teachers or doctors, because I know many very good doctors and psychiatrists who will instead think, okay, is this, I will give 2 extreme examples, is this ADHD with anxiety, with some obsessional compulsive type traits? This child is no behavior problem at all, but they have serious attentional problems holding them back at school and in every way, but they have almost crippling levels of anxiety. That's their second diagnosis, which 4 out of 5 ADHD children do have. Okay. They be treated in exactly the same way as the ADHD child who has no anxiety at all whatsoever, who instead shows callous, unemotional traits, whose other diagnosis is conduct disorder and the beginnings of what you wouldn't diagnose till adulthood, which might be a personality disorder of the antisocial kind. Do you see where I'm coming from? Totally different in terms of the kind of nervous system that child has and the way in which it might respond to either diet or medication. I was onto this very early on because I've always worked really on the front line. My original background, Peter, after university, was teaching. That's where I came across the very large proportion of children who we are letting down, and our education system is not recognizing or dealing with the real issues. The dyslexia, the ADHD, the developmental coordination disorder, and now the autistic spectrum. That diagnosis has been rising exponentially. So you really have to ask, what is going on in our environment that is increasing the rates of all of these conditions? But I'll come back to ADHD. Here is the clinician. Parents have brought the child along. As I say, there is a huge difference here between the ADHD child with anxiety and, let me say, depression. Very, very high overlaps between ADHD and depression. If you take, as good clinicians do, if they have the time, a full case history, you ask about family history, you will probably find that one or both of the parents may themselves have depression, or perhaps some addictive disorder, perhaps, one of them, it's a predilection for alcohol, who knows, or smoking. So you will get more of a picture there. What is it that might help this child? And I will say as well, the stimulant medications, it's not well advertised. They are far more likely to be less effective and have more side effects in those ADHD individuals who have the anxious and internalizing and depressive other symptoms than ADHD. That really interested me from the very beginning because I was working across different conditions, researching both ADHD and doing some of the earliest studies. We published the very first case studies of both depression and schizophrenia. Okay. Almost proof of concept. Sometimes you can indeed, at the single case level, dramatically improve things if you get the nutrition right. But yeah, the link between ADHD and mood disorders, we do now know, and we have meta-analyses of the very large number now of randomized controlled trials. Long-chain omega-3 are effective for reducing symptoms of depression. There have been fewer studies of bipolar disorder, but here in Oxford, we did the Cochrane review there and showed that of the bubbling under studies, helping, again, alleviate the depression rather than to treat the mania. So yeah, I think we always need, when dealing at the clinical level, to look at the person and not just think, oh, the label is ADHD and the answer is stimulant medication. That's...
would you say you had more success with EPA-rich oil or DHA-rich oils, or doesn't it really matter?
Now, here, let me start by saying there is no natural food that provides one without the other. Yes. But this question has absolutely been one that researchers, have been onto. So have companies, of course, to try to decide which one should they put in their supplements or perhaps try to patent. Now, from the earliest, it was a bit of a surprise, but EPA rather than DHA appears to be, if you have to choose one, that is the one that is most effective against depression and other mood disorders. Okay, so for depression, I would say the data are pretty clear. And it's between 1 and 2 grams a day of EPA that characterizes the most successful supplements. That is now in published treatment guidelines that any interested doctor can download. It's an open access paper from the world's leading psychiatrists and researchers in this area. So if we come back to the ADHD individual, if they have a profile that is very mood swings or anxiety, or if mood and emotional problems are part of what is causing their behavior problems, okay, I would then tend to suggest that an EPA-rich supplement might be better. But in other cases, you've always got to look at the individual. If there are visual problems, it's DHA, not EPA, that is needed. 1/2 of the retina needs to be DHA. If it isn't, vision does not work properly, okay?
Right.
And again, handwriting, because another condition that overlaps hugely with ADHD, with the autistic spectrum, with dyslexia, is dyspraxia, or developmental coordination disorder. So handwriting difficulties. We've seen at the individual level in children in some of our trials, absolute transformations within 3 or 4 months in that child's ability to hold a pen or pencil, to be able to form letters, to even be able to place them in the right place on the page. So yes, if visual, perceptual, or visual attentional issues are part of the profile, I would not want to not give quite a lot of DHA.
Yes, yes.
Again, we have to remember, it's really become clear in recent years, if you want to raise blood and tissue levels of any particular omega-3 or omega-6, you've got to give that individual fatty acid. We do have some ability to turn EPA into DHA. We don't seem to do the reverse. Very clever, sophisticated studies have been looking at this for a long time. Can we retro-convert? No, it seems we can't. But if you give DHA, the interesting thing is EPA builds up because you are sparing some of the EPA that would otherwise have to be used to make DHA, to keep your vision and your brain and your heart going. So I do think it's a slightly artificial question. Is it EPA or DHA? But having said that, no question that for depression, EPA or EPA-rich supplements appear to be performing best. Also, interestingly, in the area of heart disease.